Good afternoon, everyone. My name is Madan Kumar. I'm Grants Manager at India Alliance. It's a pleasure to host the session today. On behalf of India Alliance, I extend a very warm welcome to our speakers, Professors Gagandeep Kang and Vikram Patel, and also the attendees, India Alliance grantees, and non-India Alliance colleagues as well. We look forward to hearing about this very exciting initiative and how different stakeholders may contribute to the Lancet Citizens Commission. So before I begin, just wanted to share a couple of housekeeping announcements. So your video and microphone will remain switched off during the webinar. If you have any questions while the speakers are presenting, please put them into the questions box that you see on the dashboard on the right. You can also raise your virtual hand during the question and answer session. And when you do that, we will unmute you and let you ask a question or share a comment with the speakers. This webinar will be recorded. And in case, due to some technical issue, the webinar ends abruptly, please join back using the same registration link. So with these opening remarks, I now hand over to Vikram Patel.
Hi, thank you very much, Madan. So I also want to extend my welcome to everyone who has joined the webinar. I would like to, first of all, thank the India Alliance for so generously, first of all, arranging this webinar. It's a great opportunity for all the members of the Commission and the larger Commission fellow group to share some of our initial thinking, but also importantly, to gauge the interest of at least we hope some of the members of the India Alliance who represent in our mind the leading clinical public health and basic science researchers in the country to collaborate and partner with the Commission on one of the many different research studies that we are proposing. I would like to acknowledge, apart from Gagandeep and myself, that many of our fellow commissioners, as well as the broader community of researchers who have already started working with us, are connected to this webinar. And quite a bit of the material that Gagandeep is going to present in a moment is actually the collective effort of the entire Commission and indeed many of these other non-commissioners who are researchers who are contributing and will continue to work with us in the coming 1.5 years or so. I want to acknowledge my fellow co-chair Kiran Mazumdar-Shaw, whose name I see on the list of participants. Kiran, thank you for joining, and also to my other fellow commissioners. I can also see Dr. Leela Varki. If there are any of you, there's a long list. More than 70 people have already signed in. So my apologies if I haven't been able to keep track. If there are any other commissioners who are also signed in, please just drop me a chat so I know you're connected, and if there are any opportunities for questions that you might want to answer, please just indicate that to me as well. The goal of today's webinar is really very much to share extremely early thinking about our plans. This is in the spirit of our goal to be participatory, to constantly be sharing our ideas with a broader community in India, obviously the citizens of India, but also within the citizens, the research community. So please don't be prepared for some kind of detailed presentation of methods, but just be prepared for a high-level architecture of our thinking, and be prepared to critique us and to make helpful and positive suggestions. And also, I hope, engage in a conversation with us about how some of you may be involved with us in the coming months going forward. So without much further delay, I will now hand over to Gagandeep, who will introduce the Commission in more detail, as well as the way we're thinking about the research. Gagandeep, please.
Gagandeep, you're on mute. We can't hear you.
Yeah. Hi, I'm Gagandeep Kang. I'm from the Christian Medical College in Vellore, and I've been working in a relatively narrow area of health for the past 30 years. And I find that as I get older, I become more ambitious. And if I look at what's happening with in India in health research, it makes me wish that I was 20 years younger and had the opportunity to engage with fellows like you. So can you see my first slide? Yes? Okay. So this is the Lancet Citizens Commission, and it is unusual among Lancet commissions in being a commission that is seeking to engage with both the users and the providers of health in India. I think there is no question in anybody's mind that we do need to be thinking about reform of healthcare in India. The figures, of course, are staggering. Our last NFHS is showing us that we continue to have chronic as well as acute malnutrition as non-communicable diseases grow. Health system access is low, and our ability to respond to health emergencies is relatively limited. The Lancet Citizens Commission on Reimagining India's health system is a very ambitious initiative where we hope to develop a roadmap for achieving universal health coverage in a period of 10 years. This is very timely because it is aligned with the WHO's triple billion targets. And it also comes at a time where our health systems have been disrupted like never before, highlighting some of the problems that all of us knew existed, but which have been amplified in the pandemic that we've seen over the last year. The vision of the Commission is that healthcare can't be viewed through the prism of charity. It's not a commodity for the rich, but it is a fundamental element of sustainable development for the entire country. So our aspiration really is that all Indians should have access to a similar quality of care without the risk of catastrophic health expenditures, that universal health coverage must include preventive, promotive, and curative aspects of mental and physical health. And the state has a large responsibility, even though the state cannot and will not be doing it alone in terms of the provision of health, but it certainly needs to be a regulator and a steward of the health system. So in the Citizens Commission, we aim to put citizens at the heart of our endeavor and bring together diverse voices across India's fragmented healthcare landscape. And this sounds ambitious, and it is, but the idea really is that we've done top-down for a really long time. What will it take to involve the users of the system as well as the providers of healthcare? So if we take a look at the commission is an independent effort. It's not part of the government. It does seek to have diverse stakeholders, including several who are currently at government institutions or were previously part of the government. And the idea is to develop a roadmap. There are co-chairs and commissioners and project staff and researchers across the country. There's an urgent need to develop quality healthcare, and the idea really is to publish a report in 2022 when India has completed 75 years of an independent, being an independent nation. The Commission's work is divided into 5 work streams, and each work stream is led by commissioners and co-chairs. The work streams are citizens engagement, governance, human resources, financing, and technology. And we'll come to each of these work streams and what they're going to, which the commissioners are that participate in this. So if you look at the financing work stream, it's led by Nachiket Moore and Tarun Khanna, who's a co-chair, and Kiran and several other members will be names that you will recognize from their diverse fields of experience. Similarly, for technology, for governance, for human resources, and sorry, I've lost the slides on my screen.
See it though, Gagandeep.
Sorry.
We can still see the slides.
Okay. Okay, it's back for some reason, must be an internet issue. So the last work stream is citizens engagement, and we really view that engagement as being central to what the other work streams are going to be doing. It needs to align with what citizens expect out of our healthcare system. So in order to be able to deliver on this very ambitious agenda, we've developed a research strategy that's in really 3 phases. The first phase is for the work streams to identify their research questions, to develop research protocols, and then to have methods that will allow us to address these questions in phase 1. And these include stakeholder consultations, systematic reviews, and case studies. And these will lead then to scenario analysis, district level case studies, and modeling exercises in phase 2. And all of these are embedded in the idea of a theory of change that will provide us the direction for developing the roadmap that we hope to have in 18 months. So in phase 1, we are planning to do a literature review, and this will be systematic reviews that will be coordinated by CMC Vellore. There will be stakeholder consultations with communities, with frontline workers and health providers. This will be done by the Population Foundation of India. And there will also be stakeholder consultations with health providers from the private and informal sectors, as well as the many groups and people that feed into health systems, for example, technology companies. And this will be done by multiple stakeholders led by different members of the commission. So if I just talk about the systematic reviews, CMC has a Cochrane Center which has led the ability to set up protocols for systematic reviews for a while. And now the idea is to not focus only on randomized controlled trials, but also on observational studies and other designs in order to produce reviews of the current state of play in health systems. And if we set up groups, they will involve people who volunteer to participate, but also have methods input from people in CMC and domain expertise from people that will be identified as part of the team that takes these forward. So this is a slightly more detailed description of this approach. So each work stream will identify research questions to be addressed through the systematic review. They will develop a protocol. And for this, CMC is planning to provide specific training in March. There are 26 classes that are scheduled for this. And this will then allow us to formulate the groups that will then conduct the review. And there will be a second protocol completion workshop in September, October of 2021, and that will result in conclusions and recommendations, and we hope publication. This work will be done in collaboration with and with the guidance from the work streams, both the chairs and other people who participate in each of the work stream areas. So what are the kinds of questions that could be asked? Here we have the example of the citizens engagement work stream. where if you look at citizens' experiences of the private, public, or informal systems, then we can do a systematic review of the global and Indian literature, which will allow for a great deal of learning on what works and what doesn't work. Considering what are citizens' aspirations around healthcare systems, there is very limited data available for a systematic review, so this might be supplemented in addition with survey methodologies. If we look at exemplars of community participation and accountability in healthcare, there are now, over the last year and a half, the kinds of studies that have been done by the exemplars in global health, which could be a methodology that we could use towards this approach. For citizens' preparedness to participate in healthcare, we could look at systematic reviews as well as surveys. As Vikram pointed out early on, this is something that we have begun to evolve, and we are really looking to you and to others to critique this as well as participate in these exercises. For the stakeholders consultations, the research questions for the consultations and the stakeholders need to be identified. Research protocols and the size of the studies need to be done. And then data collection and analysis and reporting are going to be part of our early phase testing. So if we look at research protocols, I just used some examples, one from a user's perspective and another from a provider's perspective. What are the kinds of research questions that have been identified by the work stream on citizens' engagement? Who do we think the respondents would be, and what are the methods that we think should be used? Again, this is something where we would welcome your comments on the approach as well as your participation. So if we look at the provider's perspective, one sample research question is, what role do trade bodies such as doctors' unions or organizations, nurses, laboratory technicians see in ensuring UHC implementation? Another similar question would be, what kinds of threats does a government provider see from the private sector? So you can see that the questions are complex, and we will need to think through them and how and with whom we try to address these kinds of questions. So what are the next steps for us? We are working on finalizing the research questions for each work stream. We anticipate that this should be done by the end of this week or early next week. We're organizing workshops at the end of February to finalize the protocols for the stakeholder consultations, and a workshop on the theory of change, which will be different workshops for different participants. So how can India Alliance Fellows engage with the Commission? We really hope that a lot of you decide that this is something that is of interest to you and that you would like to participate in. You could participate in, you could lead a systematic review in an area of your interest in one or more work streams. And as I said, this is not something where you would be asked to jump in and do it on your own. It is something where CMC will provide the training, and there will be people available for hand-holding. We are looking for teams to be set up that can work together on systematic reviews, and these, of course, will be publications as well, and we hope they will be high-quality publications. If that is not something that you would like to do, but you still would like to be engaged, you could be available to review a protocol or to critique an output. And this could be in the form of remote reviews by email, or it could be at webinars. We are looking at, as you saw, lots and lots of stakeholder consultations and surveys. One way that India Alliance Fellows could participate is to conduct the stakeholder consultations or surveys where you're located or within your network. And again, when we come to case studies, if it is in your area of interest or in your neighborhood, perhaps this is something that you would like to be engaged in. You may have other ideas for engagement as well, and we'd really welcome hearing from you. What are the timelines? The commission has already been established and launched. The commentary was in the Lancet in December of 2020. And the stage that we are at now is research and engagement, and a very early phase of that stage. The idea is to do sequenced research studies, starting with the systematic reviews and stakeholder consultations, and then using those to inform further studies. And the engagement with the public, with the media, with our communities is something that we plan to continue throughout the time that this commission is in existence. By early next year, we hope to have an analysis and synthesis of all that has been done to triangulate the research findings and then lay out the roadmap to universal health care and prepare the commission report. Currently, the time for publication of the report is August of 2022, and I really hope we can stick to that timeline. But that essentially means that a lot of the research work has to be ramped up with great speed now. What are the outcomes of this? We will have a roadmap to realizing universal healthcare in 10 years with specific actions, actors, and milestones. The report of the commission will be published in 2022, but we also expect multiple secondary publications, the systematic reviews, the stakeholder consultations, as well as other publications in journals and in the form of white papers. We need to have wide dissemination and a lot of engagement with the public as well as with the government, because without government engagement and resources, it's not going to be possible to move forward. And an ambitious goal is one where we hope that people recognize the value of health and recognize that health is a human right and speak for it. So with that, just to tell you who our various partners are, we really want to be as engaged as possible. And we are very, very pleased that the India Alliance is with us on this. So thank you very much. And over to you, Vikram.
Thanks a lot, Gagandeep. I think we'll pivot straight into questions in a moment. If you could maybe just turn your slide screen off so perhaps we could see each other. I've had a chance to just look at the attendee list. We have more than 80 people, not including the Alliance staff, so that's terrific. But I also wanted to acknowledge at least a few names of commissioners that I have been able to spot on that list. I have to say GoToMeeting isn't the easiest to read, but we've got Vijay Chandru, we've got Kiran Mazumdar Shaw, Thelma Narayan, then we've got Leela Varki, Sapna Desai, Armida Fernandez, and I am sorry if I've missed any of my colleagues' names, but at least it's terrific to have at least 8 or 9 of us on the Alliance. And in many ways, I think this reflects the enthusiasm that the commissioners have of engaging with the India Alliance research community, and I hope that that enthusiasm will also be reciprocal. So there's a lot of questions. I wanted to just add a few things, just amplify a few things rather, that Gagandeep has already said. I think the involvement could be very, very, as it were, high, from 20,000 feet, simply looking at what's happening and giving constructive comments whenever you have any, remembering that we are also aware that this is a very audacious, ambitious, and complex research exercise. It isn't a classic research study. We've set ourselves, some would say, almost unbelievable ambitions and timelines. And so obviously we would like to welcome critiques that are going to help us achieve these goals in the spirit of collegial collaboration. That's at the highest level. For example, reviewing protocols, the list of research questions, all of which we will over time place on websites in the spirit of transparency so that these can become public documents that people can comment on. But on a deeper dive level, as Gagandeep has emphasized, what we're really hoping is that at least some of you would choose to become members, a growing community of already more than 24 researchers, early and mid-career researchers who are acknowledged by the Commission as Commission Fellows. You can go to the website. Indeed, I would strongly encourage for you to visit the website, which is www.citizenshealth.in. So you can actually see the growing number of institutions and researchers who are involved. What you get out of it? All of you are very busy. I myself have been a fellow for most of my career, and I know we have a lot of stuff going on in our lives. So this is really something added. You have to find that space of time to add to already a very busy life. You have to make that decision based on your own context. But in return for that, what you get, number one, is to be acknowledged, obviously, as a fellow of the Lancet Commission. Number two, to work in a team that is interdisciplinary, intersectoral. As you can already hear from just the composition of the commissioners, we have all kinds of disciplines represented. The opportunity to be mentored perhaps by senior members of different disciplines, senior representatives of different disciplines as per your choice. Obviously, playing role as authors, provided you meet the authorship criteria, including, as Gagandeep has rightly pointed out, even lead authorship of the many papers that are likely to emerge in the coming 18 to 24 months based on the very many different research methods that I have just that she's just described. And this would therefore be the more additional benefits that you might accrue from being involved with the Commission. On that note, I'm going to just pause here and maybe just I don't know if attendees can speak, but if they can, could I just invite any of my fellow Commissioner colleagues if they would like to add any other comments on how the research community in India, particularly the Alliance research community, could potentially be involved. Please feel free to just speak up because I am having difficulty actually seeing the list of everyone on my GoToMeeting webinar. Just unmute yourself and speak up, and I hope you can unmute yourself.
The attendees can raise a virtual hand.
Okay, you can apparently.
Can you hear me?
Kiran, please, Kiran, go ahead. Yes, of course, please go ahead.
So I can't really sort of participate except to speak, but let me say that this is a very exciting partnership opportunity between the India Alliance and the Lancet Commission. And I would really welcome, this opportunity and effort to be done in a way that we can leverage off each other. I mean, I know that, Vasan and I, of course, have worked very closely over the years. And I do believe that this is one endeavor and initiative which is for public good. And therefore, I believe it's a very important partnership opportunity. And I really would like the India Alliance to suggest whatever is possible from their end and whatever they believe they can do for this effort.
Thanks, Kiran. Maybe Vasan, as the CEO of the India Alliance, I'd love to hear your thoughts as well. In your mind, what would be the potential ways in which the Alliance as a broader network, but also fellows in the Alliance could potentially be involved?
Yeah, first of all, thank you, Vikram, Gagan, and Kiran for sharing your thoughts. I think you very well articulated, Gagandeep, in terms of what this commission is all about, what are the aspirations, and you also articulated in terms of how you see or you envisage the India Alliance Fellowship or network of grantees participating in this. And I really liked your finishing line where you spoke about health as a human right. That probably is the big dream for all of us, right? So in our capacity as part of India Alliance, we would be very happy to really bring in the linkages, help to facilitate how our fellows can be a part of this commission and how they could contribute. I think you listed out all the options of either being participating or leading in the systematic review. I think a lot of people on the list here, I can see some big names here are really well versed in doing this. So I would really like to hear from them in terms of what they think, how they can participate, and we'll be happy as an organization to really facilitate and coordinate.
Thank you, Vasan. So I know that there are lots of questions out there, and some of those are questions which probably I would suggest we could answer offline. You could always email Gagandeep or me, and then we can either try our best to answer them. I'm going to try. I don't know, Gagandeep, can you see the questions yourself on your screen?
Yeah,
you can. Okay. So I'm not sure what the best way of using the remaining half an hour is. One way, of course, is I think the best thing is questions that are specifically talking about roles would be the ones that we would, I think, best use this time for, because others can also benefit from it. More specific technical questions we could park, but for now, I'm going to just see the list of questions. Apparently, you can raise your hand as well, and then just ask your question if you raise your hand. And I am just going to ask you to raise your hand if you can, and if I can see it. Okay, so Gagandeep, there's a question here about, will the Commission engage with other efforts that have impact on health systems? And the specific obvious reason I'm asking you to address this is because it's about zoonosis as an example.
So I see, absolutely. So Abby, I think this is something where if you were willing to take the lead on talking about how this would be important from a surveillance perspective, as well as from a delivery of healthcare perspective, that would be very welcome. And we could see this slotting in quite nicely with some of the work that will be required for developing the roadmap. Preparedness for epidemics, preparedness for disease spread is something that is top of everybody's mind, and this would be a nice fit. I think one of the things that maybe Vikram and I forgot to mention is that we are considering also whether it might be possible, in addition to individual level publications and systematic reviews, whether we should think about supplement to journals of global health, where a number of these papers could be published together. So that is certainly something that we would consider, where it might not be necessarily a review topic that has been identified by a work stream, but if it is an important area, we could consider figuring out how to create additional bodies of work that are relevant. And for communicable diseases, this is certainly one. Whom do you contact for involvement is Mahesh's question from JSS. And if you look at the website, there is contact information there, but otherwise feel free to write to us, and I'd be happy to connect you with the work streams that you're interested in. The next question is, what is the public engagement and participation strategy of the Commission? Do you want to take that, Vikram?
Sure. I also wanted to say one more thing just to follow up about how you can get in touch with us. Just be aware that we're also ourselves organizing our thinking around the matrix of research methods and research questions. And so there might be a little bit of a kind of an iterative process in which we try to figure out what is the talent that you bring and the contribution and time that you can commit, and how best could that then be partnered with one of the existing work streams or indeed one of the research methods. For example, It could be that your primary interest is in a method. I see that somebody's asked a question about how to make the commission less research heavy in terms of classical research and make it much more participatory. So it could well be that, say, for example, you have a experience in participatory research methods, the witness seminars that somebody else has asked about. Then in fact, what we might do is we might think that your talent would be best used in helping develop the protocol for that particular method, which is not specific to a work stream, but is actually a cross-cutting method that will address questions from across the work streams. And then you could then be part of the entire implementation of that particular method as part of the research team that's going to implement it, and also, obviously also in the analysis and the synthesis of that data. To the more specific question about public engagement, in many ways what we're doing right now is what we see as public engagement. This is of course with a very particular community of academics, of researchers. But in the same way, we envisage public engagement at the level of the community in the very first phase of work. We call it stakeholder consultations. If you think there's a more friendly way of using that term, please do let us know. But essentially, that is going into the community through organizations that already have trust with those particular communities. For example, Seva would give us access to the large network of women who are associated with the organization. Similarly, Sneha, that is Dr. Armida Fernandez's organization, Mumbai, with the urban slum poor community, etc. So the idea is we would use a protocol. We would design a protocol centrally, but then it would be adapted and applied by partner organizations that have historic access to these communities. I noticed somebody else mentioned people with disability, and that would be another great example of a vulnerable community that is often neglected in conversations about health. So absolutely, we intend to very much engage with the network of institutions. So you could bring not only your research skills, but you could also bring a particular skill that you have in connecting with vulnerable groups, a particular relationship you have with organizations that are able to do that, and look at how we can actually include those as knowledge partners. When you go to the website, you're going to see many different institutional logos. In the last slide that Gagandeep showed, you will already see many institutions from around the country which are already knowledge partners, from smaller NGOs to larger public sector institutions like IIPS. And so, we welcome also the partnership of institutions that have specific expertise and are able to contribute to the research methods. The other public engagement, we do have an effort to try and get commissioners, as well as hopefully over time people associated with the commission, to write on subjects related to health, and obviously where they feel that they want to associate themselves with the commission, they're free to do that. Although of course those op-eds don't speak on behalf of the commission, they speak on behalf of only the person who's writing there. But certainly that's a way to also raise visibility about the effort as well. With the government, we have a liaison officers in, I think, both the Niti Aayog as well as in the Ministry of Health and Family Welfare. And our plan is that every now and again, at a regular interval, we will give an update to the government, keep them informed about the state of the different kinds of research activities that we're engaged in, early findings as they emerge, and invite them for their comments and suggestions on how these can be actually actioned as we go forward. The most important thing, of course, is we don't only want to land up a year and a half from now with a list of aspirational statements, but we really want to be able to be quite specific about what needs to be done and be able to connect those specific actions both with experiences on the ground, for example, by comparing districts that have done very well with districts that have not done so well, but also connect that with citizens' voices rather than just the perspectives of, as it were, people like us who are researchers or senior members of our various disciplinary communities. Gagandeep, over to you. Can you see any more questions on that list?
Lots of
Vikram and
questions.
Gagandeep, if you'd like us to
please
give
go ahead.
audio and video access to any of the commissioners or researchers, please do let us know. We can give them audio and video access.
Yeah, please do that. I mean, I'll just tell you this: Vijay, Thelma, Leela, Sapna Desai, and Armida Fernandez. These are the people I can see on the list here. So if you could please just give them video access, and invite any of them if they wish to add anything. Please feel free to do so.
Yeah, we'll do that. In the meantime, I think we have a few questions from Dr. Prashant Srinivas at IPH Bangalore. May I go ahead?
Can Prashant just speak?
Yeah.
Yes, please do that. Yeah, actually, please don't ask me. Just do it. Yeah, thank you.
Yeah, thank you. This is a wonderful initiative and much needed. I feel like I had a lot to say, and I don't think this is necessarily a forum to list out questions. So I'm looking forward to engaging with the commission through the channels available. One overall comment is.
I think we lost Prashant.
Yeah, I think we lost Prashant.
Oh. Perhaps you can switch a pivot to someone else, and then when Prashant is back online, we could ask them.
We have a couple of questions from Suresh Kumar Kamalakanu. Suresh, if you could unmute and speak, please.
Yes. Thank you both for explaining this wonderful opportunity for us to look at reimagining and building our health systems. I'm Suresh Kumar. I'm an occupational therapist by training, but with expertise in public health and disability. My primary question was related to looking at disability and mainstreaming disability within the agenda for health in terms of looking at reimagining health systems on the whole. Are we looking at this particular perspective? And if so, how do we actually look at it within the overall objective of this program? Thank you.
So maybe I'll take this question because disability is a particular area of my own work. Given that I think some of you will know I work in the area of mental health, and some of the most devastating disabilities are cognitive disabilities. So thanks for pointing that out, Suresh. In fact, I remember in our slide deck, as we were seeing the slides, one very important word that was not present after curative was interventions that promote inclusion. Yeah, it is very much part of our mandate. We believe that universal health coverage extends all the way to supporting the lives of people who have long-term enduring disabilities, and particularly around the areas of inclusion, not just in the health sector, which is of course the fundamental goal of the Commission, but also exploring connections with other sectors that promote inclusion. So thanks for raising that, Suresh. I hope that you will perhaps consider this as being something that you might bring to the Commission. Your unique perspective on disability, I think would be very welcome.
Absolutely, thank you, Vikram, and I'd love to contribute. And I'm just looking at all those pillars that's there, and in terms of where exactly disability can fit in, and it looks like as if all the pillars have disability as one particular domain that can be missed out. I'd love to contribute. And another information that I wanted to share, especially given we talked about systematic reviews, is that at the moment, Cochrane India network is getting formed, and I think we have about 10 affiliate institutions that will be launched by end of March to look at evidence-informed decision making for Indian health systems altogether. So I think if will there be any opportunity where this whole network of say 10 institutions that they are planning to bring together as Cochrane India Network contribute to the efforts that's made in the Commission as well, please?
Absolutely. And for systematic reviews, it's a lot of work. So the more groups, the more people that we have engaged in them, the better it is. Some of these will be immediately relevant to the Commission. Others may be sparking ideas that may play out in a longer time frame. But I think strengthening the ability to do systematic reviews and use those systematic reviews in an initiative like this is very important. Again, as I said, if there are India Alliance fellows that are interested in starting almost immediately on systematic reviews, starting March 8th, there is going to be online classes for developing protocols for systematic reviews, not just for RCTs, but also for other kinds of studies. and anybody who wants to participate, this can be arranged.
Thank you, Professor Gandhi. It's of immense help for us to understand this, and I'm sure lots of allied health professionals like me would love to look at systematic reviews for complex interventions, especially rehabilitation or disability management interventions as a part of this work. Thank you both.
So Prashant is reconnected. Prashant, please speak up.
Yeah, thanks. I was just saying that there are a bunch of questions which I'm happy to engage with later, but for the purpose of this discussion, I was wondering whether, given that this is a citizens commission, one of the my understanding was that there are ways in which more experiential knowledge, which is not necessarily grounded in academic types of knowledge, will be foregrounded. Knowledge systems which are not necessarily based on systematic reviews, for example, which are also important. So I wonder whether there are ways in which the Commission can think of direct participation of people who have faced vulnerabilities of various sorts that exist, and how these, which are not often at all available in academic channels that we access through papers, how can this kind of knowledge and experience be better integrated into the Commission's findings?
So in fact, Prashant, this is precisely what citizens engagement is all about, and the Population Foundation is going to be leading this work. And they are going to be mapping stakeholders within government systems as providers, as well as communities to whom these services are provided. In addition to that, we are also going to be looking at the private sector and informal providers. So it's really both the providers from multiple systems of health, including Ayush, as well as the users of healthcare that will be included. And much of this, as you said, does not come out in the peer-reviewed scientific literature. So it's really going to require both surveys and stakeholder consultations. Like clearly they
Prashant,
didn't
if
do
I
a
may
good
also
job of communicating this.
No, Prashant, I also want to just say, I think maybe, you know, again, I know your work, and I would strongly urge and hope that you will connect with us separately offline, so that you can be part of as much as you possibly can in the development of the protocol of the stakeholder consultations that Gagan Deep has just spoken about, because I think you're absolutely right. Engaging the voices, not just of people as participants, but even potentially, I think what you might have been alluding to is also as potentially as researchers, you know, people who are in fact, you know, involved with the research process more actively rather than in a passive way. I wanted to now just ask Vijay to respond. Vijay Chandru, if you are there, you know, there's a few questions that have come up by people about how basic scientists, people who work in technology, might be playing a role. Vijay, over to you, please. So you're muted,
Vijay. Vijay. We can't hear you.
Yeah.
Oh, okay. Yeah, it's been unmuted now. So can you hear me now? Am I clear?
Yes,
yeah,
Vijay.
Okay. Great. Thank you, Vasan. So, so I was going to first make a comment that, you know, I'm going a little into the whole disabilities issue. I would also like to point out that, you know, orphan diseases and you know, rare genetic disorders is another, you know, aspect of you know, leaving no one behind, which I think we you know, we will probably, at least I will have a real focus on that, both from a citizens engagement perspective with the patient communities and caregivers, and from a technology point of view. I think today we are in a position to end diagnostic odysseys and perhaps also, you know, move towards therapeutic options that you know, that I think can be reimagined, right? But I think from a technology point of view, there is both the excitement about, what digital can do, and I think, in some sense, being able to reach, the population through things like telemedicine and so on, which have clearly taken on a rapid new dimension and scale, and and with the government's own sort of commitment to the National Digital Health Mission, there's certainly going to be a lot of technology aspects to that. But I would also, I think, from the Wellcome Trust Fellows perspective, there's also, probably a lot of room for innovations that, in medical technologies and particularly towards preventive diagnostic and preventive aspects of the health system, where there could be a lot of interaction and useful inputs from the fellows and work towards a more universal health system. I also want to mention that we do need technology as well to monitor impact and to be able to measure better how policies are playing out. I think we're still, the national health surveys and so on. How do we actually leverage heat maps, data, analytics at a very different level to be able to actually have more impact in what we do. So I think these would be some comments. I think certainly with more engagement and as the work stream also gets pinned down, there will be other aspects. If there's a specific question on technology, yeah.
So if we can bring two more important questions. One is from Rajiv Sarkar, where he says, can we engage as an institute and what is the process? Question number one. Second question is from Jimon, which says, would there be any financial assistance to do primary research? I think two important questions, which probably will open up a lot of people's interest.
So Gagandeep, would you like to?
Sure. So Rajiv is at the Indian Institute of Public Health in Meghalaya, and we are looking for partners in the Northeast. That's an area that gets neglected a lot. So one option would be to think about whether you want to come on board as knowledge partners, as well as engage in some of the research that needs to be done. So with regard to Jimon's question, this is not a research funding organization. The research is for a purpose. So if we anticipate that there will be very little primary research, but if it is primary research that is filling a gap that can be done in the timelines that the Commission is looking at, then it may be something that is feasible, but it's hard to tell without knowing what that is.
Yeah, I guess as Gagandeep has rightly pointed out, in the phase one, what we're really doing is primarily using the resources of the partner institutions. And here I need to acknowledge, she's been very modest, but CMC Vellore is supporting very many of the central costs of the systematic reviews, and the Population Foundation of India is supporting the costs of the stakeholder consults. But I think maybe Jimon might have been referring, Gagandeep, to the phase two work, which is much more elaborate, which is conducting large-scale surveys in the country, as well as the district-level case studies, which obviously will involve teams of researchers going to districts and conducting district-level analyses using a standardized protocol. Obviously, these will involve investment of resources in these sorts of these sorts of methods. The institutions are giving in-kind support in terms of, for example, the time of the researchers. Let's say, for example, in the case of the case studies, IIM Bangalore has a Center for Public Policy, which will be contributing in kind, as it were. But also, we would be looking at additional financial resources in the form of grants. And we are currently actually trying to develop a rough costing for some of these much more research-heavy methods, and seeking support from funding agencies to support us. So, definitely we are looking for grants, and if for those more direct costs. But a lot of the costs right now are being met in kind by existing funders, funded researchers, also by institutional resources. Back to you, Madan.
Yes, we might have a question from Professor Geeta Trilok Kumar. May I request Geeta to please unmute? Professor Geeta Trilok Kumar from Institute of Home
Hello,
Economics.
can you hear me? Can you hear me?
Yes.
Yes.
Yeah. Thank you so much. It's an interesting work that you people are doing, and something that is really essential. I just have a quick question. Part of it has been answered if there is research funding, but I also wanted to know if you would like to engage institutions in this endeavor, and how can institutions like university colleges contribute to this. And I mean, we can send you an email with ideas, but is that an option?
Let me have a first go at that, and maybe I'll invite Gagandeep to speak. Ultimately, you're right, institutions can partner, but ultimately it's people within those institutions who will be involved. For example, if you look at our website, you'll see the institutional logos of, for example, IIM Bangalore, or IIPS, or CMC Vellore. But ultimately, it is people within those institutions, usually individuals who are very passionate and are willing to commit time or have the space in their agenda to be part of it. So ultimately, it is individual researchers. If it helps them to have their institution as formal knowledge partners in terms of facilitating their engagement, then of course the institution is also welcome. But I think you and I know that is simply, as it were, a kind of more of a formality, because the institution itself doesn't, in fact, do anything other than facilitate its people to take part. But yes, we are, take a look at the website. And I know that we're running out of time, and a lot of the questions are about participation. My colleague Shubhangi, I hope she's still on the call. She is. Shubhangi will send Vasan a Google spreadsheet, not a spreadsheet, a form that we are using to get people who are interested to just complete the form. It's a form with pre-filled headings, and that will give us a chance to look at your interests and given what questions you also have. And then we are trying to organize the numbers of people who are shown an interest and have sufficient time to contribute into either into research method or work stream based groups, and then we will then get back to those individuals with further information on potential ways in which they can contribute. So that Google form is something that you should fill when Vasan will circulate it to you all. And also, please look at the website. Some of you asked for things like the presentations, etc. You can get a bunch of stuff, including this presentation, on the website itself. Plus, you can keep up to date with information. We're trying to put on the website an alert system. It's not there yet. So that you can also sign up for alerts. For example, an alert that there's a protocol that's been posted on the website, and invite people to actually comment on that protocol. That's not up and running yet, but it will be in due course. And everyone who registers on the website now will automatically get a request to sign up for the alerts when that's up and running. Gagandeep, would you like to add anything to that?
No, I saw a lot of the questions, and I hope it'll be possible to send the questions to us so that they can be addressed offline, because I'd be happy to respond to each of them. I tried doing a few during the webinar, but wasn't able to address all of them. Just to say that I really hope a lot of you get engaged. This is important. It's ambitious. It's very, very challenging. But without all of us doing this in addition to everything else that we do, we aren't going to make a lot of headway. So we really need you, and we hope that you'll join us.
Thank you. So as an immediate next step, so we will get the document, Vikram, shared by Shubhangi, which we will distribute to all the participants. We will also share the questions that were posted in the chat window here, so that it can be addressed. And a lot of these questions have some common themes in terms of funding, participation, mechanisms of public engagement, how deep, how wide. So all these things can be addressed. Apart from that, is there anything else you would like to say as a concluding remark in terms of the immediate next steps, and how do we reconnect again, or any final thoughts?
Yeah.
Vikram and Cherry.
Yeah, well, Vasan, I know I speak on behalf of all the commissioners to express how excited we are to partner with the Alliance, to again express our thanks to you and all those who took part today, and to make it very clear that we see this partnership as a fundamental one for the credibility of the Commission and ensuring that the work that we do is going to have wide currency with the different stakeholders who we do need to influence. So this is not a tokenistic effort, it's a very active effort. The very fact that 9 of our commissioners joined this meeting is a reflection of our interest and commitment for this. So please see this as the first step of conversation. We do know that this is not going to appeal to everyone, but we do hope that some of you will be involved with us, and then Vasan, we can have perhaps every now and again review meetings to report back to the wider group on progress, on findings, on directions of travel, so that there is a continuing conversation between the Commission and the Alliance in the coming year and beyond.
Great. Thank you so much. I would like to thank all the participants and all the commissioners for participating, as well as all my colleagues who helped to put this program together. As you said, this is just the beginning, and we really hope that many of our fellows could participate in this initiative in whatever capacity they can, as individuals, as institutions, and as part of India Alliance. We'll be very happy to facilitate as knowledge partner. And again, we can look at opportunities for funding if there's something that comes out. Okay, so we really look forward to sustained engagement and see how we can participate.
Thank you, Vasan.
With that, thank you so much,
you
everyone, and have a wonderful evening. Bye-bye. Thank you.
Thank you.
Thanks.
Thank you, Brian.